Have you ever noticed someone's hand trembling uncontrollably, or seen an older person walking with slow, shuffling steps? These might be signs of a condition you've probably heard of but may not fully understand: Parkinson's disease. It's not just about getting older. It's a specific neurological disorder that affects millions of people worldwide, including famous figures like Michael J. Fox and Muhammad Ali. So, what exactly is happening inside the brain of someone with Parkinson's? Let's break it down in a simple way. Imagine your brain has tiny messengers called neurons. Some of these neurons produce a chemical called dopamine. Dopamine is like the oil that keeps the gears of your body's movement system running smoothly. It helps control everything from walking and balancing to writing and even smiling. In Parkinson's disease, the specific neurons in a part of the brain called the substantia nigra start to break down and disappear. When these neurons are gone, they can no longer produce enough dopamine. It's like your body's movement control center is running low on its essential fuel. Without enough dopamine, the brain's messages to the muscles get jumbled and slowed. This is what leads to the classic symptoms of Parkinson's. The most well-known is the tremor, that rhythmic shaking, which often starts in one hand, arm, or leg, especially when the person is resting. Another key symptom is which is a fancy word for slowness of movement. Simple tasks like buttoning a shirt, cutting food, or getting up from a chair can become incredibly difficult and time-consuming. People might also experience rigidity, where their muscles feel stiff and tight, making it hard to move freely. And finally, there's postural instability, which affects balance and can lead to frequent falls. But Parkinson's is more than just a movement disorder. Because dopamine plays a role in many brain functions, its loss can cause a wide range of other symptoms. These are often called the non-motor symptoms, and they can be just as challenging. For example, many people with Parkinson's experience changes in their speech. It might become softer, more monotone, or slurred. Their handwriting often gets smaller, a condition known as micrographia. They might also struggle with depression, anxiety, sleep problems, a reduced sense of smell, and fatigue that feels overwhelming. It's a complex condition that affects each person differently. So what causes these brain cells to die off? That's the million-dollar question that scientists are still working hard to answer. It's likely a combination of genetic factors and environmental triggers. Some people may have a genetic predisposition that makes them more vulnerable, and then exposure to certain things in the environment, perhaps toxins or viruses, could trigger the disease process. But for most people, the exact cause remains a mystery. It's important to know that Parkinson's is not contagious. You can't catch it from someone else. It typically affects people over the age of 60, but it can sometimes start in younger individuals. While there is currently no cure for Parkinson's, the good news is that there are many ways to manage the symptoms and maintain a good quality of life. The most common treatment involves medications that help replenish or mimic the action of dopamine in the brain. These drugs can be incredibly effective, especially in the early stages, at reducing tremors, stiffness, and slowness. In addition to medication, therapies play a crucial role. Physical therapy helps with balance, strength, and mobility. Occupational therapy helps people find new ways to perform daily tasks. And speech therapy can improve voice, volume, and clarity. Lifestyle choices also make a huge difference. Regular exercise is one of the most important things someone with Parkinson's can do. Activities like walking, swimming, tai chi, and even non-contact boxing can improve movement, balance, and overall well-being. A healthy diet and staying socially engaged are also key. Living with a chronic illness can be emotionally challenging, so having a strong support system of family, friends, and support groups is vital. Parkinson's disease is a journey, not a destination. It's a progressive condition, meaning it changes over time. But with the right combination of treatment, therapy, and support, people can continue to lead active and fulfilling lives. By understanding the science behind it, we can replace fear with knowledge and compassion. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe for more content that breaks down complex health topics. Stay curious.